One of the things that sets us apart from our competitors is the presence of our registered nurse care coordinators in the room with the patient. If you think back to the last time you were seen in an outpatient office, you were probably greeted by a receptionist, maybe waited in the waiting room for 10 or 15 minutes, eventually got taken back by a medical assistant for some vital signs, and then maybe waited alone for another 10 or 15 minutes in an exam room before your provider entered to spend 5 or 10 minutes with you, probably with a laptop in between you the entire time. In our model, the registered nurse care coordinator actually greets our patients at the door and remains physically present with our patients for the entirety of the encounter. So Patty would collect the patient's demographic and insurance information, then get a little bit of history on them as well as some vital signs. Once she gathered all of this information, she would alert the provider that the exam was ready to begin. While they're waiting for the provider to come onto the screen, Patty is building a relationship with the patient and actually collecting additional information that we might miss during a traditional outpatient appointment. For example, she's able to gather additional data on the patient's mood, on their mental status, and maybe even some lifestyle data on their diet and exercise as she's chatting with them about their day.